pacing is really important. So being able to ease your way back, a lot of the old school male mentality, right? Like just push through it actually leads to more injuries. But on the other end of not pushing through any pain or not,
Yeah.
doing anything, then it leads to that like atrophy, right? And so somewhere in the middle, finding the pacing that is appropriate to not overdo it, but not underdo it.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
Good morning, Andrew.
Good morning, Dave. Another Friday, another recording Friday. This is honestly like a big thing that I do look forward to every week. It signals it's a Friday and it's our recording day.
For sure. I like walked out of the house and my wife was like, "How come you're going so early?" I'm like, "We got a double recording day, and I'm happy. Like I'm telling the kids happy Friday on the way out. I'll see you tonight." And yeah, just love doing this. So
I can just see you like just bolting out of the house, like, gotta go record.
well, I do the lunches and some of the other prep stuff, and then my wife does the drop off. So my jobs were done, and I'm like, I will see you guys tonight. And yeah, for the weekend coming up. So, but today we are going to focus on chronic pain, and we're going to have a little bit of a shorter episode, just time wise. So, I want to dive right in. And I know you have a lot of experience in this area. I don't have a lot of experience in this area, but I've been doing a lot of like research and reading, preparing for this episode. So, do you want to
Yeah.
maybe start us off with maybe your experience or kind of a definition of chronic pain? Yeah.
Yeah. Chronic pain is, well, pain in and of itself. Oftentimes, in my experience, I've worked with cases where there's been an accident, whether it's a motor vehicle accident, workplace injury accidents, even just, freak accidents, someone on a recreational snowmobile trip and, an accident occurs. Also, with workplace, insurance gets involved, motor vehicle accidents, insurance gets involved. There's just so many layers to chronic pain and pain in of itself. So when someone gets into an accident, let's say they hurt a joint, a ligament, break some bones, perhaps even some internal injuries that they recover from. So they may be in the hospital for a while, after the acute response. Then they get into rehab therapy to try and get their functioning back, to whatever level they can. For many people, the goal is to go back to what they were functioning at. But for also many, that's not possible, right? Whether it's because their body's just working differently now, or perhaps pain. And having worked in a hospital, a rehab hospital in Kingston, Ontario, I was doing my residency there. It was very interesting to see those coming into rehab, and then the number of cases where pain was an issue. And so you have the nurses and physicians who are trying to figure out the pain. And in many occasions, yeah, there's a physiological background or factor into the pain, in which case, is that medication, treatment, or perhaps physiotherapy and other therapies to help ameliorate the pain. But at the same time, after a while, you will have those who are struggling with what we call chronic pain, right? Pain that doesn't seem to go away, and pain that doesn't seem to be seen on any kind of scans, any types of, medical treatments in terms of x-rays and all sorts of other things. And doctors are telling patients that, there's no physiological reason why there should be pain,
Yeah.
right? And this is when we get into this idea of chronic pain. And chronic pain has so many different features to it when it comes to what it feels like. I think for many clients who I worked with in private practice, as they finished all their treatments, all their rehab, and now they're coming through perhaps referrals from lawyers, self-referrals, insurance companies. The accident may have happened months, if not a year ago, right? And yet they're still experiencing pain. And the frustration for so many is like, we're being told that they're not seeing it, therefore it shouldn't exist.
Oh, I was gonna say that some of the most frustrated clients that I see, it's around chronic pain, right? And the pain is real. They're experiencing real pain, but not having that physical or like you were saying, physiological reason for it. It's not identified in a scan or an X-ray or something like that. So a lot of times these clients, these patients are almost like having to justify or explain or feel like they're not being believed. And, pain is it's subjective, right? And so we can rate it on a scale of 0 to 10, but my scale might be a bit different than your scale. So it can be this ongoing challenge of trying to find the cause and going to different specialists and different, yeah. So,
And when people try to find the cause, right? Like let's say something does show up in a scan, and this hope that, oh, if it shows up, then someone can do something about it. It can be fixed. But when it can't be seen, we may have talked about this in a previous episode. When it cannot be seen, then it becomes this idea of, oh, it's unfixable. That means it's all in my head.
mhm,
And we can't put a band-aid on my brain. And so what does this mean in terms of quote unquote fixing the problem?
yeah.
Right? And that's where the frustration, if not anger, lies. And well, I know we just did an episode on anger, but I do see many clients with chronic pain also really struggle with their anger.
Yeah. Well, I think if there's a physical cause for it, then it's not your fault. If it's all in your head, then, is it my fault? And I don't like this is a very challenging kind of area because it's like now you're blaming me for my pain and
Hmm.
like there so a lot of times people are looking for that physical explanation because then it's like, well, there's a reason for this and it's
Yeah,
not anything I can do. But
yeah,
so much of, especially when pain goes from kind of what we would call like regular or acute pain to
yeah.
this chronic pain. And some of the definitions that I've seen with chronic pain, it's like it persists for, longer than 3 or 6 months beyond the regularly expected time for an injury to heal. So the tissue damage typically should have healed, but then there's this pain that persists. And again, it's just a really frustrating experience for so many people.
It's a very lonely journey because for many clients, when now they believe it's in their head, it's the idea that, okay, well, if nobody else can see it, doctors are saying goodbye, can't help you any further because we're not seeing anything here. It's very lonely because only the client feels it.
Hmm.
Nobody else can physically feel your pain as you're complaining about it to a spouse, to an offspring, to a relative, to a friend. They can't actually know what it feels like. All they can hear is your voice complaining about it. And I put complaining in quotes, and they can't see it. They're like, well, you look completely fine.
Hmm.
But internally you don't feel fine.
So I think we'll talk more about this, but like what is the psychological aspects of pain, right? And all pain is subjective and it's in our brain. There's a like whether you broke your arm or you have this ongoing residual pain from an injury, it's real pain. So full stop, but being able to kind of understand how like even just being frustrated with our pain can make our pain worse.
Yes.
And yeah, so
It becomes such a focal point in one's life. That pain that's bothering you every time you lift your arm, every time you sit down to go drive, every time you are watching TV and you move your leg and it's there. Clients can no longer enjoy reading a book sitting down, watching TV, going out for a walk. It becomes very functionally limiting. And we go back to that word functional, where it's now changing the way you live and the way you go about your activities of daily living. right? So you are now having to learn and to adjust your life because of this entity that's within you that nobody else can see, that people might even allude to that you're faking it. And especially now you're dealing with insurance companies. And it just becomes such a daunting journey.
Yeah, I mean, insurance companies generally don't want to pay out money if they don't have to. And so you get this almost battle between like, is this real is someone faking this to get money, right? Like, are they in psych terms malingering, right? And so you'll go to even be referred to other people to rule out this, like, this person is just trying to get money from this injury and they're actually not in pain. So again, that creates this whole other layer of like complexity when insurance companies are involved or when people are trying to justify their injuries to actually get some compensation. Rightfully so. I think a lot of, I mean, the people that I've seen, there's never going to be the compensation that would make up for not having the injury or not having the pain. But yeah, on the other end, it's a
You're
business. Yeah.
you end up almost fighting multiple battles as you're going through this journey of chronic pain. And I hear from so many clients, like, why me? Right? Why did that accident have to happen to me on that fateful day? Right? If that never happened, life will continue as is. I will have no pain. I will not have depression. I will not have panic attacks. So why me and why that day?
Yeah, this isn't pain related, but I'll just throw this out to the listeners because this is, it this actually came from like a couples therapist that's written a bunch of books. If you didn't have these problems, you would have different problems, right? So sometimes we can get so focused on if that didn't happen or if this wasn't like that. I find that really gets me out of that jam sometimes when I'm starting to go down that spiral. It's like, yes, that would not be a problem for me if that didn't happen, but I would likely have other problems. So, how am I going to cope with these problems that are part of life? And I don't want to minimize this by any means. Like,
Hmm.
especially with pain, it can be this like life altering,
Hmm.
like chronic. It's almost on a daily basis for so many people, and they've lost so much of what they used to be able to do. And I have a ton of empathy and compassion for, the people suffering with this.
Yeah. And I do hope that we will have a neuropsychologist on in the future to talk about further about what's happening in the brain when it comes to chronic pain and neuroplasticity and the way changes after injury. I think that would be a very interesting discussion. Neither of us are neuropsychologists, and but I think just understanding what's going on in the brain would be so interesting. So many avenues we can go down when it comes to chronic pain, like we mentioned, functionality. I wanted to bring up too, though, with chronic pain, so many other comorbid or concurrent issues, psychological issues can come up. When we think about chronic pain and we talk about how one's life has changed, it's so important to think about when that person's life changes, how easy or how difficult it is to adapt. And for those who are having a really tough time adapting, you can only imagine some of the psychological barriers that start to form. So if someone is starting to appear to be quite hopeless, that, you know what, this chronic pain isn't going away. I'm thinking about it 98% of the day. I'm always reminded of the accident. I'm always reminded of the pain. That hopelessness starts to sink in, and then you start to get into a sort of a depressed state or, exhibiting symptoms of depression. And the research has shown that up to 50% of people with chronic pain also experience depression because now they have had to change their lives. Maybe they can't go out like they used to. They can't go and play tennis or softball or whatever it is like they used to. And so then their social network also declines.
I don't think chronic pain ever makes someone's life better, right? Like
No.
very rarely. And I've even seen a stat that it's up to 85% of,
Oh, wow. Okay.
yeah, experience depressive
85.
symptoms.
Okay.
Well, and maybe so let's exclude the whole like insurance company aspect of it. Let's just look at pain itself. And I'm looking at this, you can Google this, the pain cycle, and just kind of see for those listeners that have not, experienced chronic pain for a sustained amount of time, this is what happens or can happen. So pain is a signal that something is wrong. You know, if you sprain your ankle, you probably shouldn't walk on it, right? So it's like, ouch. And then I got to adjust myself because something bad happened to my body, typically. So, and what we found is that there's then muscle guarding. So the muscles will tense around the pain area, which kind of acts as like a natural splint. So if you broke a bone or you fractured a bone, the muscles can tighten around it and kind of strengthen that area. That's great. You might reduce the chance of further injury, which again is the whole purpose of a lot of our pain. And then from there, if that continues, that muscle guarding continues, you start to have restricted mobility. So
Hmm.
you don't move as much, which again, if you have a broken bone, might be great. But once the bone heals and you've continued to have that restricted mobility, maybe you like, you walk more on you put more of your weight on one foot than the other foot, things like that, that just would kind of subconsciously evolve from this injury. And then you have muscle weakness and atrophy. So your muscle actually, breaks down because you're not using it as much, right? So, and then you have decreased function, which you've mentioned a couple of times, right? So now, because you no longer have the muscle or the muscle strength, you actually can't even do the thing that you used to be able to do, right? And then the last part is the emotional and mental stress that comes with this, right? And you could see how this cycle could go kind of round and round and round,
Hmm.
right? And one of the strategies, like we want to break this cycle, is you definitely want to get cleared by your doctor and make sure that you don't have, an injury that you're going to make worse, right? But that you want to start to activate and do those things, even if they're causing pain, because it stops all of the rest of the cycle, right? That muscle atrophy and the reduced mobility and actually being able to do some of the things that you want to be doing, right?
Yep.
So again, I think we'll dive more into this, but just kind of understanding how this natural, normal cycle can happen. And all of a sudden, you could be feeling quite terrible about your life circumstances, but it started with a broken ankle, right?
Yeah. It started with a broken ankle. And again, it's like people will go back to that initial incident. It's like, why did I break my ankle?
Mm-hmm.
Right? There's a lot of looking back in the past and really just dwelling on it.
Mm-hmm.
Right? The other piece too that I wanted to touch on as you were diving into what chronic pain is and how it affects our body and all the other peripheral areas that it impacts. So as you're compensating, for example, and now other parts of your body starts to hurt because you're compensating, you're walking on your left leg more than your right leg, and so now your left leg is feeling pain. One area that I often provide psychoeducation to clients about when it comes to chronic pain is the idea of harm versus hurt,
Mm-hmm.
right? So when working with clients with chronic pain, oftentimes I do have to delineate and distinguish what is harm and what is hurt. So many clients will stay away from the pain. They will just avoid it as much as they can. And again, because it's so hard to avoid, that becomes an issue. That sort of hopelessness sinks in again. It's like, I'm always going to be feeling this. Like, this is what I'm being told. It's like, okay, so there's a difference between harm and hurt, where hurt is this temporary feeling of pain that maybe if you, let's say, use your arm a certain way, you feel sort of a twinge, right? It's a little uncomfortable. It may last for about 5 to 10 seconds. It's like, ooh, moved it the wrong way. Technically speaking, when the hurt is there, it's not actually creating any further damage to what you're feeling.
Mm-hmm.
I think that's the best way I can put it.
Yeah.
Whereas harm is you are causing more damage, right? So if you continue using it, that particular part of your body, you are going to make it worse, right? So there is harm. And there's that big difference. And that's an important distinction because even if you are feeling chronic pain, doesn't necessarily mean you have to avoid the hurt, right?
Ex-
You can still do that thing, but are we able to live with the hurt? Are we able to function with the hurt?
I think that is like, we'll keep coming back to this because this is the most important piece that I have learned in my research around this is just being able to sort out, you know, is this going to make my injury worse or is this going to allow me to actually strengthen my body and do things that I want to be doing? So the pain itself is actually not dangerous. It's not harmful. And being able to sort that out, a lot of people will err on the side of caution. Our brains err on the side of caution, right? It's
Yeah.
like the last time you did that movement, it created a sharp pain. So let's avoid doing that movement. Makes a lot of sense, right? Like I think if you kept
Hmm.
walking on your broken ankle, you're not going to serve yourself very well. And even the athletes out there will know, like returning before your injury has healed can either lead to re-injury in that same spot or like you were saying, injuries in other areas, right? Because you were compensating for an injury that has not healed yet, right?
Hmm.
But most people, and a lot of times we don't have a clear indication of like, has it actually healed or not? Right? Am I going to make things worse by doing that activity or moving in that way or sitting in that position? Right? These are very stressful, kind of like, especially when the pain is acute and almost like a lightning bolt that can jar you. Those are very strong messages to like, don't do that again.
Have you, when you work with clients, Dave, and it comes to chronic pain, what are some of the concurrent issues that you've come across that seems to really be an obstacle or a barrier for clients to improve?
Well, I think, yeah, we mentioned it in the anger episode, right? Like, but I think it's more than just anger, right? It's any kind of like your body's in a stress response, right? So that could be anxiety, anger. It could be, for whatever reason, your body's on high alert. It's almost like hypervigilant, right? And naturally, if you've just been hurt or if you had a very life-changing injury, you're going to be very careful and cautious. But that high alert, that hypervigilance, even when we're looking at like trauma, emotional trauma, right? Not just the physical trauma, all of a sudden, like you said, there's a comorbidity. There's like these things travel together. So
Hmm.
what starts first? Maybe you were already super stressed and then you got the ankle injury, right? Or maybe you got the ankle injury and then you became super stressed because you weren't able to do your job anymore or play with your kids or so I don't know. I think there's just looking at like the whole package. And unfortunately, because I didn't have a lot of training in this area, I
Mm.
often I often avoided the chronic pain aspect of it. I would refer out to like there's pain clinics and there's other specialists, there's medical doctors that specialize in this area. So maybe myself even kind of playing into the avoidance part of it, right? Because I'm like, I don't want to make this person's injury worse. I don't want them
Yeah.
to like hurt their back more than their back already hurts.
Yep.
So I'll focus on reducing their stress and doing other like from the psychological perspective, but maybe I'm like also condoning or like supporting the fear response that might actually keep them in chronic pain. Now that I'm
Mm.
realizing this, right? That like maybe my own fear around making an injury worse actually might not have helped some clients that were looking for support with chronic pain.
This is where I found working with chronic pain clients or those experiencing chronic pain, it's been really helpful to actually get those medical reports to see what's been done and what are the physician's opinions. And even in terms of functional mobility, adaptability, what can they do, right? So if they've been assessed by an occupational therapist or a physiatrist, physiatrist, for those who don't know, is a medical doctor who works with patients going through rehab. It's nice to know, okay, how much can they do from those who have assessed. So that even as a psychologist, when I'm working with somebody trying to get their functioning back up, if the report says that, walking should be fine, maybe not extended walks, but they can go for a walk in the neighborhood. It's like, okay, glad that they've been cleared to do that,
Hmm.
right? So now that I know that from a medical perspective, they can do it or they should be able to do it. I'm really careful with the word should. Okay, so now what is the barrier to actually going out there for even 5 minutes?
Which brings up pacing, and you'll see this a lot. And I think, even as you're talking about that, I was like, oh, I defer people to their physiotherapist, right? That
Hmm.
is going to look at their range of motion or the amount of time that they should be spending doing something, like you said, 5 minutes, 10 minutes. But pacing is really important. So being able to ease your way back into something rather than, pushing yourself again, a lot of the old school kind of like male mentality, right? Like just push through it actually leads to more injuries. But on the other end of not pushing through any pain or not,
Yeah.
doing anything, then it leads to that like atrophy, right? And so somewhere in the middle, finding the pacing that is appropriate to not overdo it, but not underdo it. Right. And again,
Yeah.
you need medical professionals and other people weighing in on this because it can be a very scary process.
Yeah. This is where I have found when working with clients who have chronic pain, it's been really helpful to show them that we can have moments without pain. And that's where my office, and I know this is challenging for many people, especially when pain is on your mind like 90% of your day. But being able to do any kind of mindfulness, any kind of relaxation exercise, because when we do it in office, you can actually see the pain sort of melt away. Metaphorically, it just sort of melts away. You see the softening of the facial gestures, you see the softening of the body in the office. And it's like for that moment, whether it's 15 minutes, 20 minutes that we're doing the relaxation, it's like, they don't feel it. Right. At the beginning, you might see them sort of wiggling around in the chair, but then afterwards, as those who really get into it, it's like, it's gone for that period of time, right? So if clients were able to bring that home and try it out and find ways of practicing the relaxation, at least then they can really find that 15, 20 minutes of just relaxation and not have to feel the pain. The other thing that I started to do when I was practicing more with clients with chronic pain, I love the acceptance and commitment therapy model.
Hmm.
I know, CBT was all the rage when it came to treating chronic pain, but for some, it just didn't work, especially those who had a lot of should statements, a lot of why me statements. They just couldn't get over the hump of my life was derailed because on that day I got into an accident. And it should have been this way, it should have been that way. I should have left 5 minutes later. If I did all of that, none of this would have happened. Right. And they love or hate CBT, it's really hard for clients to move on from that. So I really like the ACT model, the acceptance and commitment model, where we take a really softening approach that, yes, it happened. We can't get away from that, but how can we work with it now?
Yeah. Yeah. And for those, I mean, we're probably going to do an episode on acceptance and
I think we
commitment
have
therapy.
to.
Yeah, we have
We
to.
have to.
But at its like real basic level, it's you accept, kind of what's happening for you right in this moment. And, whether it's pain, emotional pain, physical pain, there's an acceptance piece to it, not trying to overly change anything. And that, is like our mindfulness episode. And then you're committing to value-based action, right? So even if you're in pain, you might choose to still, play with your kids, right? And just not letting our current feelings always like dictate what we're going to be doing. And, even being clear about what your values are and what's important to you. If you are limited by your chronic pain, right? Like you
Hmm.
can only do so much, how do you make those decisions? So I love acceptance and commitment therapy too, especially with this, because we don't have to wait until the pain is gone to actually live a value-based life.
And we're not saying that we have to get rid of the pain.
No.
That pain may be lifelong, right? And no professional can give you a crystal ball to say that, yes, I will treat it and it will be gone in 3 months. And if we come from the mindset that, okay, it's going to be there, and how can I live with it? How can I move on with it together? Right? I almost sometimes, when I've had clients work on certain exercises, it's like, let's hold the hand of this pain. Right?
Hmm.
Let's treat this pain as an entity. If we envision a person,
Hmm.
pretend this pain is a person, how do we walk along together? And sometimes we can tell a friend, hey, go away. I can't do I can't see you right now. Right? I need some space.
Yeah.
And sometimes we can tell the pain the same thing. And at times, yeah, we want our friend to be there and be like, okay, you're a bit of that annoying friend, but I can withstand you. Like it's tolerable.
Yeah, I think you're essentially you're changing your relationship with the pain, right? And
Exactly.
so you're externalizing it to be able to interact with it in a different way. And I know, like I'll be remiss if I don't mention this book because this book has been super helpful to me. It's called The Way Out by Alan Gordon. And a lot of what you're saying, I'm flipping to parts of the book, like you mentioned. What are the things that lead people to maybe feel more pain or to be stuck in pain longer? He basically says in his practice, what he's seen over the years, three kind of characteristics that often, like you said, not using the should word, but like people that have a tendency to worry a lot, that are already kind of worriers, have, higher anxiety, tend to have more chronic pain. Those that put a lot of pressure on themselves, that are hard on themselves, and kind of what you were mentioning, right? Like, why did I do that? Especially if maybe even the accident was their fault, right? Maybe they were the one who were texting and got into a car accident, and then, why was I so stupid? Why would I have like,
There's a lot of guilt in there too.
yeah. And then the last one, self-criticism. And so, our episode on self-compassion, right? And looking at even acceptance commitment therapy, but self-compassion, right? These ways of like changing your relationship with the pain, but essentially, again, I'm going to go back to this book one more time. Like he talks about the pain fear cycle.
Hmm.
And, pain triggers feelings of fear. Then the fear puts the brain on high alert, which causes more pain, which then leads to more fear, which then leads to more pain,
Yep.
right? So even just looking at that, and if you can recognize and you can go, ooh, ouch, like I am feeling a sharp pain in my lower back, and it doesn't mean that there's something wrong with my back, right? After
Yeah.
you've ruled that out, right? Like it's like, okay, I'm feeling this sensation and it's painful and it's not dangerous, right?
Yes.
So now your nervous system can relax a bit, right? And once your nervous system relaxes, then maybe the pain isn't as intense,
Yep.
right? But
Yep.
again, it's going to be counterintuitive because automatically pain triggers our nervous system to go into high alert.
It's essentially rewiring the brain and how we think of these dangers, right? If you see a bear in the forest, yeah, you should run, right? And so, yeah, you feel this bit of pain and it's like, oops, something's not right. I need to be on high alert, like you said, and I have to fix this problem.
Hmm.
To one of my old supervisors who said this, so these are not my words, but in layman's terms, he said that those in his many years of experience working with those with chronic pain, and this was during my private practice days when I first came out, he said those with quote unquote type A personalities
Hmm.
were the hardest ones to treat.
Yeah, I mean, type A personalities are intense, right?
Yep.
And they work really hard to not make mistakes. And sometimes, especially with chronic pain or even like sleep issues, the harder you try, the less likely you are actually going to be able to achieve what you're trying to achieve, right? So
Oh, for sure.
again, it's like it's a paradox, it's counterintuitive. It goes against kind of like our automatic reactions. So mindfulness again is another way to start to practice some of this where you observe and notice things in a non-judgmental way, right? Because our judgments, our assumptions, our beliefs about the pain, those are going to affect, our pain itself.
Yeah. So I think with chronic pain, with this particular episode, I don't think we are providing answers per se. I've sort of felt like, we're providing some education around chronic pain. I really do believe those who are experiencing chronic pain, it is very important to receive help. Just with the number of various other issues that could come up because of pain, like we mentioned already with depression, but we also know that, for example, anxiety and panic disorders can come frequently with chronic pain, sleep disturbances, as Dave has already alluded to. Because of the pain, we're unable to sleep, we're tossing and turning, we can't get comfortable. Even with post-traumatic stress, if you've been in an accident of some sort, right? And
Mhm.
now, that is also, dissociations, nightmares, all of those different issues that come along. So chronic pain is a very complex, yeah, psychological issue that is not necessarily easy to treat, but it is treatable, right? So for
Mhm.
anyone who is struggling with chronic pain, please do reach out to a professional to receive help because it is something that can be treated, but it's very hard and very challenging to go through it alone.
Yeah, I mean the Alan Gordon, like he basically says the number one question he keeps getting asked is like, essentially, is this pain from an injury or is this what he calls neuroplastic pain, right?
Mhm.
It's like our brain has developed a sensitivity to a sensation and it interprets it as pain, right?
Yeah.
So I actually just last night at a suggestion from a client who is going through chronic pain had recommended watching like Chris Hemsworth's, I think it's on National Geographic or like Disney Plus, and it was an episode. I forget what the title of it was, but if you look it up, it's on pain, and it was a pretty neat. Like it'll actually kind of cover a lot of what we've covered here today.
Mhm.
If you like the video kind of information way of taking in some information, so it explains a lot of like how our pain can be felt differently depending on what we're feeling, depending on what we're
Mhm.
doing. It even looked at like playing a game and laughing while also being administered pain really changed the level of pain or the pain tolerance or the pain endurance that someone can have, right? So I hope that, if you are experiencing chronic pain, even if it's from a physical source, that you also know the degree that you are experiencing that pain can shift and change, and that there are treatments, like you're saying, out there to help with that.
And what's really important too is in terms of even personal expectations, are we trying to completely get rid of the pain or are we trying to lessen the pain?
Hmm.
Right. So as you're working with somebody talking about those treatment goals, because let's say you have been struggling with chronic pain for 2 years and you've been living in that state for 2 years, would you find comfort knowing that you can go from an 8 out of 10 in pain down to a 4 out of 10? Right.
Hmm.
And if you're able to get down to that, will you be satisfied and will you have reached your goal to say, you know what, this is much better and I can continue living with this amount of pain?
Again, you're automatically kind of shifting, like you said, your expectations. So if you want to eliminate your pain, you're likely going to go to battle against your pain, right? And so
Hmm.
being conscious of when you try to fight your pain, you're actually activating your nervous system to be on high alert, which actually causes more likely that you are extra sensitive to physical sensations and pain. And we could talk more and more about this. Actually, real quick, too, there's some research on, a lot of people have slip discs or bulging discs or all kinds of back issues that are structural that don't experience pain, right? Up to 65% of people with these kind of physical abnormalities actually
Hmm.
don't have pain. So even when there is this physical abnormality, it might not necessarily mean that you will experience pain. And so again, I say this just to be able to kind of question the pain a little bit. And if you just had a breakup, we're not neuropsychologists, but there's a lot of research too. It's quite interesting that the brain centers that detect pain it's the same brain centers. An emotional pain can be felt in the same place as a physical pain, and how the overlap between the two. We're just starting to scratch the surface on this really interesting area, but I think the more brain research we have, the more neuroimaging, like it's going to be taking an Advil can actually help with a breakup pain, which
Yeah.
is counterintuitive, or not counterintuitive, but like surprising in a lot of ways, right?
Well, I think that's why pain is so psychologically based. To your point about the subjectivity, an accident or an injury that happens to you, for example, Dave, and the same thing happens to me, we may endure it in different ways and we may rate the pain differently. Like, let's say you roll your ankle and I roll my ankle the exact same way. You may get a 3 out of 10 in pain, but I may experience it as 8 out of 10. And I may be out of commission for a whole week, whereas you're like 3 days in and you're back playing soccer again.
So part of my own research with this is like I have a back injury that at Christmas time I couldn't even get out of my chair, and it was really painful. And I was I was racking my brain going like, what did I do? How did I hurt myself? Was it a soccer injury that like because I play indoor soccer and it's basically on, carpet covered concrete. So when you fall, you can, and I have had a tailbone injury before. So my brain started searching for all the ways that I might have hurt myself to explain the pain that I was in, right? And then I got really careful, because I didn't want to make it worse.
Yeah.
And then I ended up getting an x-ray because I wanted to rule out any kind of fracture or structural damage, right? And then the x-ray results come back now in Alberta, at least you can check your own medical results from
Oh,
imaging and
really?
stuff. Yeah, you can go online and you can see the results before you even meet with your doctor. And my results showed that I have arthritis in my back. And then I'm like, oh no, I have a physical thing that's happening in my back. Right. And this is all before I read this book recently. Right. So, you know, I'm like, oh, I actually have, yeah, sure. I have a physical thing. I have arthritis in my back, possibly, you know, but it doesn't mean that all the pain that I feel from my back is actually dangerous. So now I've been going back to playing soccer. I've been doing the things, and my pain has actually gone down, right? So again, you need to rule out whether you're going to make things worse or better. But like sometimes our brain looks for reasons why we have the pain, and then that actually stops us from doing things, which makes, the pain worse or the muscles weaker or the tension greater. And, I just say this as like, it's been personally really meaningful to kind of come across this information that has allowed me to reframe and have a relationship with my pain and my body. So maybe that'll be my takeaway for today.
And my takeaway, I think I may have said this already, but it's such a complex disorder, that requires, sometimes I would say even a team that requires really, if possible, a supportive network of people around who are compassionate to that pain, who are patient with clients who are experiencing that pain. Because, yeah, it's an invisible disorder. Like people can't see it, and therefore some will think that it doesn't exist. And some will believe that they're weak because of it. But we need those around them who are able to be compassionate, to say, yeah, you know what, I believe you. And let's work together to make things better, whatever that looks like. And that's why I go back to really seeking out help if you are experiencing chronic pain, because I understand that it can be a very lonely journey.
Yeah. Yeah. And I believe you, your pain is real and we can do something about it, right? You don't have to
Exactly.
be kind of stuck in this without any control or any power.
All right. If you enjoyed this episode, if you are enjoying the podcast, rate it, subscribe, follow, give us a thumbs up, and leave us comments. We always appreciate them. And happy Friday. Have a good weekend. And on that note, take good care.
Take care, Andrew, and the listeners.